Excellent. So thank you all so much for joining us for our new webinar for Med Aditus Presents. Today, I think it's an incredibly interesting topic. The title of the webinar is Misinformation as a Misunderstood Challenge, Implications on Medication Management in Africa. And we have with us Dr. Brian Southwell. We're very fortunate to have you. Just a little quick introduction. Brian is a distinguished fellow at RTI International, where he oversees research on risk perceptions, mental models of scientific concepts, and public trust in science and scientists. He is an adjunct faculty of internal medicine with Duke University, an adjunct associate professor at Chapel Hill, UNC's Gilling School of Global Public Health, an adjunct faculty member at the University of Delaware. And he also hosts a public radio show for WNCU 90.7 FM called The Measure of Everyday Life. Welcome, Brian. Thank you so much. And the floor is yours.
Great. Well, thanks so much. It really is an honor and a pleasure to be here. And I'm a big fan of the work that you all are doing. So I really appreciate the chance to engage here on this topic. I've got some remarks prepared. I want to offer those, but I'm also very open to dialogue and discussion afterwards as you have questions. So I'll share my screen here, work through those comments, and then see what else you might have to say in terms of talking about this. All right. And Kara, just to confirm, you're seeing that just fine, right? Okay. So, before I get started, I do want to note I work at RTI International. We're an international independent nonprofit research institute. On this topic specifically, I also have been served as part of the scientific and technical advisory committee for a new initiative called Health Answers by Pfizer, which has been a free information service that's out on the internet and available. But I have offered some advice and consultation to them, so I just want to disclose that. And we also talked about my affiliations with different universities. So. Misinformation is certainly a buzzword at the moment. It's a challenge that many of us are facing in different ways, and there are lots of examples of this. But one example that I was involved with was some work a couple of years ago in which we were looking at some of the challenges that were faced by research staff, and we looked and actually talked with folks in 5 countries in Africa, and something that was really striking was just the overwhelming sentiment that unfortunately patient consumer engagement with misinformation was complicating their work in the context of trial recruitment, but also this was a real issue and challenge in terms of different dialogue and discussion people are having with healthcare providers, with family members. And in that particular instance, the nature of the problematic claims also matters here, because a lot of what people were referring to was comments or information that was shared on applications like WhatsApp, which pose a challenge from a research standpoint because we don't even necessarily know and can't visibly see all of what's out there, and so we know that there's a lot of many problematic claims that are being circulated, and that's something that we might worry about. And we've seen lots of news coverage to this extent, too. We saw this in the context of the pandemic, for example, worries and concerns about, myths and misinformation that would pop up in the context of calls to hotlines, for example. And so this is a complicating aspect of the work that many healthcare, public health professionals face. But the real question for us, I think a good place to start is what is this problem that we're actually facing? What is the nature of the situation? And there are a couple of questions we can ask about that. What's happening? Who might be to blame for that? What might we do about it? And I think that we have to really think seriously about how it is we actually even talk about this problem, because I think some of the ways that we talk about the problem themselves are reinforcing stereotypes and stigma in ways that might be problematic. Here's just one example in the U.S. context from a few years ago. Here's an NBC News headline that referred to the Latino population and suggested that Latinos were more likely to get and consume and share misinformation. And while there might be some empirical backing for a statement like that, there's an implication of causality or preference here, or culpability that I think is really problematic. It's not as though certain populations, certain communities would prefer to have false information or somehow value it as being better. It's just a matter of structural inequity has led us to a situation where people may have access to better or worse information under different circumstances. And so one of the questions we really have to raise is who ultimately should we be blaming? Where should we be looking for solutions? And this popped up when I had an opportunity to work with some colleagues for a review paper for the Annual Review of Public Health. And the editors of the Annual Review of Public Health approached us and were interested in us asking the question about the roles that health misinformation might play in leading to or causing health disparities. And that turned out to be an interesting question, because I think if you look at the literature, you realize quickly that the question itself is maybe not very helpfully framed. That while there might be a relationship, the notion of causal order is something that we've got to be really careful of here, and that it may well be that people that are experiencing health disparities also tend to be in circumstances where they're not helped by the information environment, but there are lots of different structural factors that are also leading to those health disparities, and simultaneously to the situations people are in terms of information access. And that's something that we found and I think really emphasized in in this review. And so another dimension of this that we might spend some time unpacking is asking ourselves, what is it we actually mean by misinformation? What is misinformation about health, misinformation about science? And I think it's probably the case that the buzzword has been used a little bit too broadly here, that to refer to anything that doesn't comport with your own opinion about how things should be in the world. And this is something that we worked through as part of the consensus study that I had the honor of being a part of for the National Academies of Sciences, Engineering, and Medicine, in which over a 3-year period we tried to look at available literature on misinformation about science, try to make sense of it, make sense of interventions that might help, and to really try to understand where we might need to go. Part of our initially challenging task was to actually define what it was that we're talking about. And in doing that, we came up with a definition that, in my mind, helps to paint a really important picture about the nature of the phenomenon and what we might do about it. You can see this here on the screen, but I'll just emphasize 2 pieces of this. The first is that we are referring to information that implies or asserts claims inconsistent with the weight of accepted scientific evidence at the time of the claim. And that's important because science itself is iterative. A claim that made sense in 1957 might not have as much backing now, and because we know that evidence evolves over time, and that we're constantly in the process of iterating, and scientists, that's the role. The scientific process itself is a matter of updating our assessment, our information. So we want to be careful that one of the problems with the internet is that claims from all different points in time are all in a flattened way kind of circulating at the same time sometimes. But at the same point, we don't want to undermine science itself. It's okay. There are instances where there are hypotheses that turn out to not be fully supported, and that's okay. That's something we want to be careful of. So I think we need to approach this from that perspective. But it's also the case that as we think about this, I think we also have to approach this question with some humility, as researchers, as scientists, because there are instances in which we don't have peer-reviewed evidence, that we have an intuitive sense, or we think that so a particular claim somebody's making is really outlandish, but we haven't done the empirical work. We don't have the peer-reviewed science to actually say one way or the other. We have our medical training or our sense that, well, that can't possibly be right. But I think that humility is important because there are some instances in which the right answer is that we don't know yet and that we need more evidence, and we've got to approach, and we find instances where people are more open to that idea of acknowledging that what they're saying may not necessarily have evidence in support of that yet, but it may not have evidence against it either. And I think that's going to be really important, is thinking about how we would approach and talk with different communities about science as a process. So misinformation is a problem that exists for really good and understandable reasons. It's not likely going anywhere for some equally understandable reasons as well. And I want to just point out some of this. That a few years ago I had an interview for a feature in JAMA that outlined some of these points. And I think there are a few things that I want to really note here. First of all, as I'll talk about, misinformation itself is actually not new. We've been dealing with this as a problem, as a concern for a long time. This is not somehow novel to 2025. Second, and importantly, human beings generally, the way that we process information suggests that we're going to at times be vulnerable or open to problematic claims, just by virtue of the nature of the way that we process information. And I'll talk through that here in just a minute. It's also the case that as human beings, we are social, and we talk with one another, and we talk with one another about many things, not just the veracity of a particular statement, or not necessarily compare notes on factual statements. You can think about this, and a good example of this is maybe the last time you got in an elevator and you saw somebody that and you might want to ignore them altogether and look down at your phone, but chances are you're probably going to talk to them a little bit. You might talk about the weather. You might talk about what a nice day or cold day it is outside. That's not new information that you're sharing. It's not necessarily factual vetting. In that case, you're really saying something that you both probably already know, but you're sharing information almost in a ritualistic way to build community, to suggest you're part of my community in some way. I want to acknowledge you. I think that that's important to keep in mind because not everybody that's sharing misinformation online is doing so in a malicious way or because they're somehow trying to spread falsehood. Sometimes they're just pointing to a sensational claim, or they're making a joke, or they're referring to something as a way of bonding, or pointing out to somebody that you're part of my community. And so there's all these vectors and ways that information gets shared, which isn't always a function of people really carefully saying, can I trust every aspect of this? And that's important to keep in mind as well. It's very easy for somebody to share something now with 1,000 of their closest friends on social media before they've really had time to to vet it carefully, and that's something that we've got to spend some time thinking about. It's also the case that even in situations where we have a regulatory regime overseeing our information environment, like in the United States, for example, the best we have is what we might think of as post hoc detection of misinformation. It makes sense that misinformation can flourish online and other places because often we're just pointing it out, and then sometimes after the fact, a regulatory agency might be asking somebody to do something about that, but there's not typically censorship sort of preventing what's actually getting online, and so that leaves us in a stance of needing to be more empathetic for audiences because people are going to encounter a lot of problematic claims. It's just the nature of the environment, so we shouldn't necessarily be blaming them for that. We also know that it's possible to correct misperceptions. We have good evidence of that. But it's hard work to do, and you have to be relatively explicit about it. You've actually got to point out that there was a factual error and that this is, and that's not often the way that we do this. And so you think about something that receives widespread media attention, and then you have a carefully worded caveat in a footnote on a website somewhere that's not fighting fire with fire. We don't necessarily have the same level of exposure sometimes for our corrective efforts as we do for what was out there, and so it makes sense that we haven't necessarily always done a great job of correcting misperceptions. But as to this question that misinformation itself is not new, I want to point back in time to a number of different examples here. Certainly, we've had lots of examples of erroneous claims, for medical products, over time. In fact, those have led to some of the regulatory regimes that we have now is because of worries and concerns, about that. And there's lots of examples around the world of instances where there is a spread of misperceptions, stigmatizing information that's really complicated the lives of different communities. And so this is not something that's totally attributable to social media. We've had lots of examples of this for quite some time. As we think about the nature of misinformation as a problem, I'd like to point out here that part of the challenge that we face, is the nature of humanity. And here's one example from the Australian context. A few years back, some of you might have seen more recently a special a movie on Netflix that depicts Mel Gibson's story, but often this is a new story for different audiences. And but in the Australian context, she rose to fame, or rather infamy, as a social media influencer who had supposedly overcome cancer through, let's just say, different nutritional means. And so she was spreading lots of ideas about different misperceptions about what might overcome cancer. Turns out her story is problematic because she never actually had cancer, and a lot of what she said was really fraudulent. And there's a lot of time we could spend ethically debating Mel Gibson as a social media influencer. But that's not where I want to put our attention. I actually want us to think about how it is that she actually rose to fame in the first place, because she was offering messages of hope in the face of what's often a devastating disease. And our carefully worded, peer-reviewed journal articles sometimes don't offer that same level of hope. And so it makes sense that sometimes misinformation is framed to be sensational, framed to answer questions that people have in ways that our scientific information is not framed in that same way. And so that's not necessarily always a fair fight, and we've got to pay attention to that. I don't personally think that there's anything magical about misinformation. You sometimes will hear the aphorism that misinformation or false information travels further and faster than true information, right? Well, empirically, there may be some evidence that you could, interpret in that way, but it's not the fact of its falsehood which is the reason why that kind of information or misinformation spreads. It's often because it's been crafted to be sensational. It's been crafted to be, to make sense and to be something that people would pay attention to, and it's because of the nature of how it's been framed, that I think is the reason why that kind of information often spreads quickly. Not because somehow there's something magic about people liking false information, per se. As it comes to information processing, we need to point out, that we've been dealing with this for hundreds of years, trying to ask questions about what happens when people encounter false information. There's a long-standing, centuries-old debate between a couple of philosophers, Spinoza and Descartes, where they actually were trying to make sense of what happens when people encounter a false claim. And Descartes gave us a lot of credit for being able to screen out false information, knowing it when we saw it. Well, Spinoza had a slightly different account, and been one that's been supported more empirically by later neurological evidence, which is that when we see a false claim, we essentially make sense of it as information, as stimulus, and then with a different part of our brain, later tag it as being true or false. But we sometimes don't get around to that tagging part. We sometimes are distracted by kids needing our attention, or being overwhelmed by an information environment, or just not having time to really carefully be critical about something. And so then you think about it, we've just taken it in as stimulus, and that's something that we've got to again have sympathy for people, because people treat stimulus as information to be
followed by
processed.
pound.
So I also think it makes sense for us to look at the changing media environment, that we all are situated in, that we all live in, now, and public health and healthcare institutions, and news organizations are competing with what we might think of as, smaller information sources, that may not be professionally trained, but that have access to lots of people, and that's really important. It's kind of leveled the playing field in a way that, is different than it used to be. We've got a general shift from a world where there was broadcast signals and channels to the internet and social media. And as I pointed out earlier in the WhatsApp, in parts of Africa example, we may not necessarily easily be able to measure or assess what it is that audiences are seeing. There are social networks that are obviously operating, but they may not be immediately available, to our institutions. So it does complicate, the world as it unfolds. And it's also the case online, anyway, that search interfaces are being transformed in all kinds of ways, particularly by artificial intelligence. And you're seeing, a sense of a neat and tidy summary of here's all there is to know, about this topic, without necessarily reference to the original sources, in ways that is also complicating, the world for a lot of information seekers. On top of this, we've got to pay attention to our humanity, and one important part of our humanity is the importance of our emotions. And emotions are not something we would want to get rid of. That's a really key and important part of our engagement with the world. But emotions complicate information processing. There's a lot of good empirical evidence for that. Brian Weeks, a former graduate student of mine, did some really interesting work on the ways in which anger lowers one's critical threshold there in terms of acceptance of political information. And you can imagine in the health context instances where people are distraught and upset over a diagnosis or helping out with a loved one, and emotions might be running high, and that may not necessarily be there might be more vulnerable to accepting information which turns out to be problematic if it aligns with some of their worst fears, for example. So often I think we talk about these problems as though they happen in the abstract, but the reality is that people are often looking on their phone at 2 a.m, trying to make sense of a particular health condition, and that's the time when we might worry about misinformation. Okay, so what can global health professionals do then about this? I think there's some general takeaways and implications of this, as I've outlined the problem, that I think have direct implication for interventions we might develop, projects we might develop. And there's a number of things that I think could be done. The first is I think part of the solution here is compassion. Compassion for audiences that, rather than shaming and blaming people, for their engagement with the misinformation, instead say, well, look, we all are in this complicated boat, together, and I think it doesn't make sense to necessarily immediately blame somebody, but instead to leave room for them to correct a misperception, to come, and that's challenging sometimes because we're often frustrated by this. It's complicating our work. It's getting in the way of our discussion about this key and important medication or vaccination or other, and that could be a matter of us judging those that are engaged in misinformation in ways that would complicate our conversation with them. It's also the case we need much more translational work here, both in terms of thinking about language, but also culture, and making sure the materials are appropriate. That's not something we do nearly enough. We've got to spend more time thinking about the information environment as people are encountering it, not just as what comes across to our desk. And that's really crucial because it's going to mean that we're going to have to move away from our peer-reviewed literature sometimes to see what are the claims that are actually circulating here. How can we get better at what's often referred to as social listening in terms of thinking about online information, but then also we know that a lot of misinformation is offline, and so what can we do to have eyes and ears respectfully in communities to kind of figure out what it is that's circulating. We do this with infectious disease, but we don't do this nearly as much with thinking about information and misinformation, and what can we do to do better surveillance of the information environment from a global health standpoint. And I do think ultimately we're going to have to empower patients themselves to make their way through and to help. We have to think about helping people to navigate the information environment. One of the ways that I like to think about this, with all due respect to folks that do work on disasters and severe weather. My wife has worked in that space for a long time, and I'm very sensitive to that. But you might think about the metaphor of a hurricane or a cyclone coming. If you are on the coast, and that's within a day of coming, there's not a whole lot you're going to do to be able to steer that away. But what we can do is help our neighbors and help our communities be ready for it or to move to safety, or there's ways we can help people navigate the storm. I think similarly we have to think about that with regards to misinformation. It's probably a fool's errand to think that we're going to be able to vanquish it from all corners of the information environment. That's not going to happen. But instead what we could do is help to shore up communities' relationships with us, to know that they can come to us at times for information, and trust ultimately turns out to be a really important piece of this equation. So I want to spend a few moments talking about that. In the specific clinical context, we have spent some time thinking about better and worse ways to talk to people about misinformation. This is something that, generally speaking, it's moving away from shaming and blaming, moving away from saying, here are the 17 peer-reviewed articles you ought to have read. Instead, thinking about an opportunity to talk to somebody about misinformation as an opportunity to talk to them about what their values are. Why is it that that's important to you? What is it that you're trying to, what are the real problems here that signaled why you're bringing that to my attention? And then to think about ways to hopefully steer them to more credible information. Often clinicians who worry about patient encounters with patient misinformation will come to workshops that we've developed and with a real sense of defeat, with a sense that, like, gosh, this is an overwhelming problem. And instead what we would like to do is to try to reframe that and to say, actually, the fact that you're hearing from patients about misinformation is something of a victory and a success. And the reason why is that they're coming to you and talking to them about it. It's better that you're having a sufficient relationship to actually talk to them about it than to have them encountering all this information and misinformation and not actually ever bringing it to your attention at all. So the fact that you actually are engaged, that's the first step towards a relationship that you could build on. Ultimately, a lot of the solutions here have to do with trust, and I think that that's something that people will often ask this in a defensive way about communities trusting scientific institutions. Instead, I think we need to flip that around a little bit and see what reasons do people have to feel connected to scientific institutions. To what extent is there a shared sense of purpose there? And I think ultimately we need to focus more on building trust and less on blaming those that don't trust us. And if you think about trust, it's less about the letters behind your name and about intellectual credibility per se. There's a more complicated, more nuanced, more multifaceted aspect of dimensions of trust that I think we need to pay attention to. And this has been borne out by work to kind of work with people to define trust in their own language and words. And often what we find in talking with people is that, yes, credibility matters. It matters if you think that a person knows what they're talking about. But it also matters whether you feel like they are predictable and reliable. Do they tend to say the same thing, or are they changing their story all the time? So you can imagine that's a real complicating aspect of the changing news environment, where we see different headlines about, well, this works or it doesn't work. But then also, I think this notion of shared interest is something that doesn't get nearly enough attention. I think it's something that explains the political situation in many parts of the world. And I think that that's something that we really have to spend more time on, because I think if I'm standing up in front of you, offering you advice with regards to medication, with regards to a particular treatment, if you think that I know what I'm talking about, that's one thing. But if you don't think that I care whether or not you live or die, and you think I have other motives that aren't aligned with yours, that there's less likely to be trust there. So it's not purely a matter of intellectual credibility. I also think there has to be a sense of shared interest, and that's something that institutions working in different areas don't often spend much time highlighting. Being transparent about their motives and talking about reasons why they actually care whether a community thrives, whether they care what interest they might have. And I think that sometimes you can refer to, there might be a profit motive, there might be other but you could be transparent about that, and then people might be able to see in that there is some degree of shared interest in going along with the recommendations that you might have. I think that's going to be a really important basis moving forward. We've spent some time here thinking about how we might build and maintain trust in science, and generally this is a call for more open science rather than less, for thinking about ways to work with audiences to kind of both design problems and questions, but also to translate our work. And collaboration, I think, is also going to be really important. Collaboration between different types of organizations, different types of professionals. One other point that I want to raise here, and then we'll move to questions here pretty shortly, is that I think part of the solution also is that we don't have sufficient mental models amongst different populations and communities as to how the process of science actually unfolds. And I think if we had better understanding of scientific processes, that we actually would see increased trust in scientific institutions. And in fact, we've endeavored to get some new evidence in this regard, and have a new paper out that actually I've marked here as in press, but it just came out, formally in print, in the Journal of Public Health Management and Practice, in which we were looking in the context of a foodborne illness investigation, a hypothetical one, different ways to frame messages to the public about that, reporting on it. And what we found was that actually, if you acknowledge the uncertainty of the situation, that we don't necessarily have all the answers, explained carefully what steps you are actually taking from a scientific process perspective, and did so with a frame of compassion, that was actually most likely to lead to perceived trustworthiness. So here's really a plug or a advocacy for compassion and transparency in all of our communication efforts. So if we're able to do that, and then ultimately also both identify areas of common and shared interests and uplift and spotlight those where those commonalities exist, we'd be in a much better spot, spending more of our communication effort actually trying to be in listening mode, to actually try to point out instances where there are shared motives and interests, and doing so in a way that acknowledges that we don't always have all the answers, that just because we are in team science doesn't mean that we are the arbiters of truth, but rather that we are somehow using the scientific process, hopefully, to answer questions that communities have. So those are just some implications that have come out. For me, I think those have implications for work as it unfolds around the world, and certainly in the context that you all are doing work on. I know in a conversation like this, we've only got just a few minutes, but I'm happy to follow this up. Feel free to reach out to me on LinkedIn, or here's my email address, and I'm happy to to talk further. I'm gonna come back on full screen though, so I can see all of you. But Chiara also knows how to get in touch with me if you are interested. So I've left some time here for questions and dialogue if that's of interest.
Yeah, if you have any questions, you can either speak up or you can put in the chat, whatever works best for you.
Yep. That's great.
I have a question, but I see Darren does too. I'll let him let him go first, and I'll ask my question afterwards.
Rebecca, go ahead, please.
Hi, Darren. Always great to see you. Thank you for the excellent presentation and thoughts and experience you bring. One of the areas of concern for, I think, all of us, but even here in Ukraine, an issue around the vaccine situation. Yes. and vaccine hesitancy existed way before this year, and certainly in America, which is driving global opinion and action, it's really degraded so much. So my question is around whether you personally have done any of the research around misinformation about vaccines, and then also if you could point us to where the best research might be, and then also like what do we do in this day and age where it's not only misinformation, the people that we look to, the science-based people that we look to are the ones that are part of the problem here in terms of dispelling misinformation. So any of your thoughts around vaccines in particular?
Yeah, no, I really appreciate that. And there's a lot to raise. There's two places I want to point to in the short term. One, I think part of the challenge that we face, and this goes back to the point I was making earlier about understanding of the scientific process. We are in a situation of public discourse now with regards to vaccination where, it makes sense that people will be talking past each other. There's not really a shared basis for understanding, how it is that vaccines were developed, what the process is, and you think about it. In the U.S. context, we've looked carefully at the common basis for education, and when it comes up in classes, it's very rarely, vaccines and vaccination is very rarely talked about. And so one project that we've worked on here, and I'll put the link in the chat, if you just go to scienceofimmunity.org, we've actually developed a module for middle school and high school science teachers to focus on the science of vaccination as examples for when you're talking about, especially obviously if you're talking about viruses and disease and immunity, but there's no reason why you can't talk about the story of the development of vaccines as a success story with regards to the process of science. And if you're talking about hypothesis testing and all that, you could use those examples. And that's something that we think would leave us in a better spot rather than just promoting vaccination. Instead, leave us in a better spot to say, look, we're all aware of how these things were developed, and we can make a better values-based discussion of what you think ought to happen there. So efforts to inform at an earlier stage about the process of vaccination development, I think, would be really important. I also want to direct your attention to the consensus study that I alluded to in the slides. I think they just changed the website recently, but if you look for let's see, understanding misinformation. I'll put this in the chat as well. The National Academies. You'll find our report there. We talked quite a bit about examples because that's really a review of the literature. And something that we found, generally speaking, is acknowledging the value orientation of people is really important. Acknowledgement is really important. So rather than just saying, "Look, this is something you ought to do," instead pointing out the shared values that we have of trying to keep families healthy, and then to point out this is a solution that that can do that, I think is really important. But finding a way somehow to just not suggest that you are evil and on the wrong side of things to reject this, but rather to acknowledge that and this is the other thing that's come up, and I've done a number of interviews in this regard. I think we are making a bit of a mistake in suggesting that a certain percentage of the population is vaccine hesitant as though it's monolithic. Like that, and it's a useful category, generally, but within that, there's so many different variants and so many different reasons. Some of the reasons people have for it is for reasons of structural access to a clinician or other things. Thanks, Emily. I see your point there. And I think if we could acknowledge the diversity, then we realize that it might be a matter of different message strategies. 5% of people, it might be this issue. Some folks aren't necessarily directly oriented against. It's just there's reasons why they're uncertain about this relative to their own health condition or other things. I think it would be healthier for us to recognize that there are many reasons why people might have some concerns, some of which can be addressed and some of which may not. So. This is great. All right, so I'm seeing a couple of hands up and then also questions in the chat. And so let me go, I think in the order that's on my screen. Hopefully that's right. Although, actually, Rebecca, you had yielded initially, I think. So let me go there, and then I'll go to Vincent second. Yeah.
Thank you. Adrian Thacker, I think I just wanted to amplify what you were saying about consistency and being there and being compassionate and shared value. This really was very much highlighted during COVID. We have a community and everybody had concerns. There was a lot of information coming from all over. So I took upon myself, as having had sufficient understanding and being able to read and interpret literature and information, to actually every day send out a email telling people, what I learned today, because it was a rapidly evolving sort of information, and it was changing also. So every time it changed, I accepted that. I said, this is how it is today. It's a rapidly changing information. So acknowledging that, but then also providing new information and interpreting that. I think it had a tremendous, certainly benefit to the community. I could see that their anxiety level had significantly gone down because of this. And I continued that throughout, the first year or so when things were just constantly changing.
Yeah,
So I just want to share that with you.
oh no, it's such a great example, and you modeled so much in that I would recommend here. And that think about it, there's a few things that you did that were really powerful. You recognize that this is going to be a matter of building a relationship, over time. That you were going to be there. Also, you weren't afraid of transparency. You weren't afraid of acknowledging that sometimes it can. I think there's a rhetorically we want to sound authoritative, but then you end up seeming less that way. If you can be transparent about what you do know and what you don't know, it can really suggest that what I am saying, what we do feel confidence about, you should feel pretty confident in, and that's something I think also we've got to acknowledge uncertainty, but then that might leave us in a better spot to say, well, there's certain things that we have pretty good consensus on, and that's something I want to relay to you here. But yeah, I couldn't agree more with the way that you approached that. Let's go to Vincent next.
For a good presentation. The point I was going to make has been touched on by Dira, and my point was, what extent does misinterpretation of information have to play? Because a lot of people rush into Google,
Yeah.
when they're sick, and they all look at all this information, they don't understand that information. But they misinterpret the information. And many times, what results is fear and just lack of understanding what they're reading. So that nobody's telling them, they're just looking for information, they don't understand it.
Yes, that's such a great point, and it's so important. And that's something I think we are doing everybody a disservice if we think about misinformation somehow as this novel independent virus that's just moving around the world and brainwashing people, and that the misinformation itself is totally responsible. In many instances, you've got people that are doing their darndest to try to help their family. They see something, they see a headline, they try to make sense of it. They're not trying to get the wrong view, but they don't necessarily have the background or training to have interpreted it. And the reason why they're seeing that piece is just an isolated piece of news, or it's on social media or whatever. But I think if we can have a more holistic understanding of realizing we're going to need, for folks, to have better training and being to discern that information, that's great, but also what can we be doing to better translate this for different audiences and to put things into context, and can we build up that relationship with community so that we can take a lot of that information. They know they can come to us to actually get that, but how often are our healthcare organizations actually serving in that capacity? We aren't necessarily always doing a great job of packaging information and translating it for people either. So people are going where they need to. I'm always struck by folks that are like, I can't believe that people would look here and there. Well, if people are deathly afraid of a disease or they're concerned, and it makes sense that they're going to go to all corners of the internet trying to find answers. And so what we can't assume is that, all right, we're just going to say, here's our carefully worded press release, and then people are going to be okay with that. No, people are going to keep looking until they feel like they have answers. And so what we're better off doing is saying, no, we're going to give you answers. They may not be perfect. We're going to be transparent about it, but more rather than less communication, and building up relationships, I think, over time is really important. Emily, to your point, I couldn't agree more on the coaching and training, and we've actually developed some workshop models in the U.S. context that I'm actually eager to talk about. Maybe there are ways we could potentially build those into community, work around the globe, because I think the coaching, this isn't easy to do. You can't just offer a couple of quick tips. It's also a matter of people bringing examples back and kind of learning how to do that over time. Charles, let me go to you next.
Thank you. Great statistics there on Africa. I'm Charles Mwangi. I'm in Nairobi right now.
Okay.
Mine are two. One is a comment, one is a question. On the issue of information processing, what is your comment, or do you have any statistics that would highlight the role of religion or cultural behavior in the areas of misinformation? And secondly, in terms of trust, the trust issue, when information comes from the government or comes from the public, there is a disparity. Do you have any information or statistics that would show that, for example, if information comes from the private sector, it is more acceptable than the government?
Yeah, those are all great questions. I think that religion, spirituality, identity, all of that, those are factors that it's interesting because I think we talk about a polarized world where people different viewpoints. I think we sometimes are quick to suggest that audiences can't get on the same, communities can't get on the same page. But I think that sometimes an expression of value or religious belief system may signal certain values, preferences, ideas that you have, but it doesn't mean that inherently you aren't able. I've actually seen really good work happening in the context of the pandemic, for example, and religious organizations able to share information with communities. And I'm not sure there's anything necessarily inherent in that. It's just more a matter of really needing to be respectful and to recognize that there are better and worse ways to acknowledge the value systems, which may not be the same for all audiences. And so that's something that I think is really important. Around source credibility, public, private, commercial, I think that's also something that shifts and changes. Here in the United States, it's problematic for a lot of audiences to now recommend that you go to a .gov site, and so things are complicated in ways that, and I think ultimately it's a matter of relationships with different organizations. I think we sometimes discount. I think there are ways in which commercial entities can actually play a really important role here, and they're viewed as being scientifically credible, and partly because people are aware of what their motives are. They're all right, well, you're trying to sell something here, but you also are doing that in a way that. So I think that's something to pay attention to. I think it really varies for communities, but I think we do need to pay attention to source credibility. I think there's instances where it's better or worse to lead with that. We have to really do work to understand what audiences are thinking about in a particular moment in time. So you're absolutely right to point out that before just adding that onto a message, we really ought to understand what the audience thinks about it. You might need to adjust, that relative to, to their expectations, and you can't just assume that it's going to be deemed as authoritative because it's coming from this source or that source. So, that's really good. Let's see. We've got a couple in the chat. Let me just see if there's any question here. I'll come to you, Avinash, here in just a second. But there was a question from Lauren. About strategies, to really lead with humility and empathy, while at the same time, pointing out, the effectiveness of introducing essential pharmaceuticals. I think that something I like to point out often is that there's a big difference, and this is really crucial, between having empathy for communities and audiences as human beings and just accepting everything that they are saying. And so there's it's one thing to say, look, I'm going to respect you as a human and your value system and all that, but it doesn't mean you have to accept what they're saying as necessarily being factually accurate if in fact it's not. And so I think we have to be careful here by this isn't a matter of just embracing the world and saying, all right, anything goes. You do have scientific training and data and all that, and there are instances where I think the key is first figuring out everybody has a right to their own sense of values and orientation in the world. See where everybody is, like, all right, here's a point of we're all agreeing on this. Given that, I've got this information for you that speaks to this particular value. And that's something that I think we need to take the listening step and the acknowledgement of to be empathetic, but it's different than just deferring to whatever information people find. And not sometimes people will say, well, everybody has their own truth and all that. Personally, I think there has to be some points of agreement that empirical evidence does matter. It can be useful for us. It can change over time, but here are people doing their I think we've got to build up worldwide empathy for researchers and scientists more than we have too, and to recognize that sometimes there's not a recognition here. Sometimes that people are doing what they can. Let me go to Avinash, I think, next.
Hi, Brian. Am I audible?
Yes.
Yes.
I found this entire presentation very interesting because it's relates to something which we operate here day to day. Speaking from India, from a work perspective, like we are today talking about misinformation.
Yep.
I've seen a era from where we had to communicate people messages who were literate and illiterate. Okay, today we have 100% literacy. We have knowledgeable people, but the biggest problem is of miscommunication, and no doubt social media is a big cause for it. Here also we have a very big problem on this misinformation because we have a lot of social media influencers who direct the people on a wrong path, and especially we have seen these cases to a very great extent in COVID period. Okay, there are a lot of medications, a lot of other systems were just pushed off, without any scientific evidence. So this stands very true because nowadays social media impact lays a very it's a very heavy burden on this miscommunication. Okay,
Yeah.
because we have very less scientists or say scientific advisors on social media.
Yeah.
Okay, and there are no very less I would say channels or links which actually gives a very authentic knowledge which is more reliable. So that's one part because okay, when we talk about government, they have act and they have rules in their places, but to such a vast population and the mass media flow, it's really becomes difficult to control. So
Yes.
that's one part. And secondly, what we see, this information here I have seen relates more to a patient when they land to a doctor in a very late phase of their disease. Okay, especially I'm talking about oncology
Yeah.
because the cost treatment is high and they keep on going to different doctors, and by the time they come, it's and because they are misguided by many people
Yeah.
on different cancer stages. So that's one part. But my question is, how do we handle this high influence of social media? One, as you said, is a trust factor. Are there any other channels where we can control this and push the right information?
Yeah, no, this is great, and in some ways this relates to Ash's worry about social media as well, or WhatsApp and all that. And I think part of the problem is that you've got a couple of different dimensions. What's happening through WhatsApp channels and through social media is that you've got information flowing very quickly. You've also got emotion running high and how can you possibly compete with that? Well, part is you shouldn't just be absent altogether, and so I think it's going to be a long road ahead. But I think we've got to find ways to build up, the reputation of and instances where you've got people being willing to be in the mix. They're professionally. This is a workforce issue, but I think you've got to have more health organizations and pharmaceutical representatives and others, thinking about both listening to what's out there, monitoring that, and also being willing to interject, and intervene. But I think, you're not going to solve the problem overnight. But I think you may be able to build up a reputation as being a credible source of information, and I think that's probably our best path, forward. And trying to think about this from a workforce perspective of that may just need to be an investment that's made on the part of some organizations to try to be available. You see this, we have response in the commercial sector. There are folks that do work to kind of quickly deal with rumors about particular products or with other, we just don't do that nearly as much, and I think we've probably got to spend some more time thinking about that, but and then also making people aware, that here's a source of information that's not overly, dry in its orientation, and it's framed in a way to be accessible, and so I think that's going to be part of the investment. I know we're getting close on time. I want to look here in the chat. There's at least one more question. Emily, you're right. There are some good folks. Kristen Pathangani and some other folks in the U.S. context are doing that, and people around the world are really trying to do some of that. The question, Karen, that you raised here, let me just quickly see. You're wondering if anyone has seen effective official pathways for identifying and addressing misinformation spreading on unofficial channels. So I think this is a myth busting, if you will, or correction. I mean, it's a double-edged sword. It can be complicated. Some people are worried about by calling attention to those myths, are you then somehow introducing them and spreading them further? I think we've got good evidence to suggest that, depending on how you contextualize it, that you can address and correct those concerns. I think it's better to be aware of it and to be acknowledging it in some way rather than not. And I think again, this goes back to my earlier notion of kind of tracing disease spread. I think similarly, we probably ought to be spending some time at least acknowledging. And I think there are some examples of agencies at different points that have tried to put reports out as to here are the top things that are circulating kind of the moment. But you might think about that as something that, in the context of your work in Karen, that there might be opportunities to do some of that work. I know we're right at 1 o'clock. I knew conversations like this always run out of time, which is a good sign. And Ash, we'll leave your last question there about this balance between ignorance and acceptance and acknowledgement. I think at the end of the day, I'm very confident that we can find ways to embrace all of our fellow human beings as deserving respect, but we also can realize that we have different training and background, and not be afraid to share that out of respect for them. I think that's partly the way that I'd approach that, because it's a really important tension. But Chiara, I'll turn it back over to you.
Yes.
I think we're at the top of the hour.
Well, thank you, Brian, so much for this incredible conversation. Thank you all for asking really important questions. This has been recorded, so you will see it on our website.
Great.
And don't forget that we have a very exciting webinar coming up in January, so stay tuned. And again, thank you all, and I hope you have a wonderful holiday season. Brian, thank you again so much.
It's my pleasure.
Bye, everybody. Thank you.
Bye-bye.
Thank you.